When you log in as a screenings and management user, and you are assigned the pharmacy permission, you will find this form with a blue header that allows you to switch pharmacy in the event that you are working from a different pharmacy that is not the pharmacy assigned. So the first thing you want to do as a pharmacist is to make sure that you have the correct pharmacy listed here. If not, you want to come here, select a different pharmacy and click on change. And this will update your pharmacy to the new one. If you do not change your pharmacy, then all the recordings you will do on the system will be logged against this pharmacy, which will create a big error on the system. And you're going to create stock in a pharmacy, and which is not going to be correct. So at that point, you will need to start deleting stuff, which will create more problems. On the left side of the screen, we have the pages menu. And when you expand this, if you are granted the central medical permission, you will find the central medical stores and supplies submenu. If you are granted the pharmacy permission, you will find the pharmacy submenu. So we will focus on these two submenus for today's demonstration. The central medical store creates the ARV medication list, enters stock available at the central medical stores, recalls stock when there is an error in entry or there's a drug recall. They can view the stock recalled. They can distribute medications to pharmacies and record the distribution, and they can view distributions. The first thing you want to do as a staff of the central medical store before you start distribution, you want to see if the pharmacy is listed on the list of pharmacies that you can record information for, record information that relates to the drug distribution. If the pharmacy is not on the list, then you want to ask the supervisor to add the pharmacy to the list of pharmacies. Once you have the pharmacy on the list, it means that you can record any distribution you have to this pharmacy. But before that, you want to see the stock that you have in the pharmacy. The stock has the date that the stock was entered, the name of the drug form, the strength, the quantity in stock, the expiry date, the batch number, the manufacturer, the type of packaging, and the amount of the medications in the pack. Anytime you see an oral solution or liquid form of drug, the amount per pack is in mils. And anytime you see a tablet form, the amount is in milligram. The strength always tells you what unit of measurement that the amount is in. So if you have 30 per pack, you have 30 tablets of 300 milligram tablets each. So once you look at your list of medications that you have on the central medical stores, and there are new supplies you have that are not on the system, which means that you cannot distribute what you don't have on the system, record the distribution on the system. And so because of that, we are going to record more drugs here. So in the scenario, we have these drugs are going to be distributed to the pharmacy. And the CMS already has 1 to 11, and it has 25 to 28. So all of these from 12 to 24 has not been entered. And so we're going to use this for demonstration on how to create the stock at the central medical store. So I will go back to central medical store and supply, and I'll click on create ARV medication list. So today's date is 21st of February, 2022. The name of this medication now is And we have it in tablet form, and it is 600 milligram tablet. The manufacturer, I'll just make up any manufacturer here. So expiry dates, let's put any date also. The batch number, the quantity. So assume we are getting 70 of this. It is in HDPE bottles, and there are 60 in a pack. Then we enter the next one, the same drug, but in a different strength. So this is in tablets, but this time we have this same drug in 50 milligram tablets. The manufacturer, so put in any date, the batch number, the quantity, we receive 100, packaging, and quantity per pack, 30. So we have the same medication again, but this time we'll have it in 200 milligram tablets. So expiry date, so batch number, the quantity, the packaging, and the amount per pack. So now you get the idea of how these medications are entered. So I'm going to enter 3 more that we are going to use at the pharmacy before I move to distribution. So this first one, we want a tablet form, 200 milligram tablet, and the manufacturer, the expiry date, the batch number, the quantity, the packaging, and the amounts per pack. Then we have the same and as oral suspension. And the strength now is 10 milligram per ml solution. The manufacturer, expiry date, the batch number, the quantity, the packaging, and the amount per pack. So let's say each of the bottle contains 100 ml. So once you are done recording your stock, you can come to view stock list to ensure that all the stock you want entered have been entered, and you can find the medication. If the list is too long, maybe you have thousands of medications, you can type in the name. When you start typing, it brings out only those drugs that you want to search. So that way you can verify that your stock is entered. This quantity in stock is going to be updated as you distribute. So if you distribute 30 to a pharmacy, it's going to reduce the number here, subtract what you have distributed. And so when we come back here to Central Medical Stores and Supply, and we come here to record distribution. At this point, we have all the medications here. So what you need to do under each medication is to click on, you will click on the pharmacy you are supplying this medication to, right? And then you select, this list is, sorry, hold on. This list is populated with the name, the form, the strength, the quantity, the expiry dates, the batch number. All you need to add now is the quantity you are giving the pharmacy. So let's say we're giving 200 and it was received by me. And I will click on the dispense button here, the distribute button, sorry. Once I do this, and it redirects me back to the form after saving it, it reduces the quantity in stock, deducts the 200. So I'm going to do the same thing for each of the for each of the drug that I'm sending to that pharmacy. And so the list continues to hold the medications you have in stock until when the quantity in stock becomes 0, then that medication leaves this list. You can no longer distribute that one. So you understand the pattern now. So you can do that for every medication, one after the other. You select the quantity you're sending and the system does the calculation and the deductions. If you record any of this in error, you come back to Central Medical Stores and Supply and you come to edit/recall stock. So when you come here now, if you have recorded a stock in error, and you have that medication, or you want to withdraw the stock from your list of stocks you have, you come back here to select the reason why you are trying to take this medication off your list and select this recall button. If it was an error in entry and you have maybe the error in the name and you know how to update it, let's say I want to change this name to add ABC, then I will put in the change on that field and click on the green edit button, and this should update that name. So this is how you edit anything you enter in error. And so we have it here updated. When you distribute a medication that was returned, the pharmacy is not going to enter the stock that they have until they have received the stock. So even if you give the pharmacy the list of what you are bringing, they will have to enter their stock to verify what they received. But for you, as the Central Medical Store and Supply, when you record your distribution, you have to ensure that you put in the correct quantity that you are giving to the pharmacy. That way, when you distribute or when you start the reporting, it balances out that the Central Medical Store supplied a particular quantity to the pharmacy, and the pharmacy also have it in their stock as they received. So it balances on both ends, and that is for accountability purpose. When you are done, you can come here to view distribution, and it gives you a printable and a searchable list of all of the medications that you have distributed to the pharmacy. And in the event where it was returned and you want to put it back in your stock, you click on the delete button and it is sent back to your stock. And so I just distributed this to my pharmacy. I want to send it back, so I will delete that out of the distribution and it balances back into the stock. So this is all the functionality for Central Medical Store. If you have any question, ask now before we move to the pharmacy.
Okay, so Mildred, I don't know if that question makes sense, but right, so let's say you get a drug from a manufacturer, you enter it into your Central Medical Store system, yeah?
Yeah.
You distributed it to your pharmacies, as we normally do. But for
Yeah.
some strange reason, the manufacturer is calling back the job because of something.
Yeah.
When you're pulling it out from your central medical store system,
so you come back to, in that event, you come back to Central Medical Store and Supply, go to edit or recall stock, and then you come here and you select. So let's say, for instance, one of this medication, this disposable tablet, is maybe defective or potentially harmful. Or you say recalled by manufacturer. You select that and you click on the recall button, and this comes out of your stock. That means you are returning it.
Okay, so it automatically comes out of the stock.
Yes, so you see now it's already out of your stock. And then if you want to see all the drugs that were recalled and you took out of your stock, you can now come to view recalled, and then you have it now under the recalled list, and it was recalled by manufacturer here. So you will know that you once had it, but you returned it. It's no longer counting against your stock, but you have the history that it was recalled.
Wonderful.
Yeah.
But that means they would have to do it from the pharmacy end also, yeah?
Yeah, the pharmacy will have to recall too. So if the pharmacy had received the stock and they have it, the pharmacies will recall from their own stock just in the same way. So any more questions? So in the absence of question, I will move to the pharmacy. So once the central medical store has distributed and they are done for the day, they've recorded the distribution, then now the pharmacy is going to create the stock that they received. So we find this under the pharmacy submenu, where we have a list of functionalities that the pharmacy can perform. The pharmacy can create stock, they can view their stock, they can view recalled stock, they can also dispense. So we have two types of dispense for the pharmacy, and you want to use the correct dispense form. If you are dispensing ARVs for clients in care, so there has to be a communication between the pharmacy and the clinical management team to decide how the prescription will be written. So the recommendation is that the prescription should have the client's care unique ID on top of it, and the prescription should also put like clients in care, or PrEP, or PEP, or other reasons, so that you use the correct form for reporting purpose. So if you are dispensing ARVs, you use Dispense ARV. If you are dispensing ARVs, but not for clients in care for other purpose, like pre-exposure, post-exposure, or when it's used to treat other conditions, you use Dispense PrEP or PEP. Then when you dispense the drug and when you record the dispense and you need to print the sticker or the label to put on the drug, you print the label from here, and then you can view all the transaction history, so all the dispense, everything that the pharmacy has dispensed out at the end of the day. And then you can also view client's treatment plan. This was a recommendation from the pharmacies, I think in 2018, that sometimes there is always a conflict. They need to see the treatment plan of the client. So they have access to viewing the treatment form that the doctor printed to see the treatment history and the treatment plan, so that they will know if the clients are on other medications that are not on the prescription that might interact for better counseling on side effects. Also, they can view the prescription history. So if a client has picked up a medication over 2-3 years and the client wants a list, or they want to go through the list of all the medications the clients have taken from the start of recording on the system, they will do that here. And then this pharmacy report generates reports for the pharmacy. So we'll look at create stock. Before you create stock, you want to view the stock to see if you have all of the medications in stock. In this pharmacy, I have just received and I have not recorded my medications for the day, but I have recordings for the previous session we had, which was last week or 2 weeks ago. But this form is a form where you can view the stock that you have, and then you can view the alerts generated based on the drugs. Now you have alerts that gives you when you have less than 50 quantity in stock. It tells you the stock is running low. When you have a drug that is completely out of stock, it gives you the flag here. Then it gives you a flag from what central medical stores has in their stock and their expiry dates. So when you want to place the order, you have a prior knowledge about the quantities you want based on the expiry dates that they have for each of the medications they have. So you have the list of the medications that they have in stock at the central medical that is about to expire or that is expired. So if you are placing an order for drugs, you already have this knowledge and you will decide your quantity or what to order and what not to order. Then when you have your medications about to expire or expired in your pharmacy, it shows up here in the yellow box. So below, you now get the form that gives you all of the stock that you have in this pharmacy and gives you a button to edit if there was error in entry or to recall if the central medical store has told you that the manufacturer asks for a recall. So this is where you recall the medication. So we want to start entering stock. So I will come back to pharmacy. And now I'll do it exactly like we did in central medical store, but the pharmacy will have to enter it in their stock to verify that they received. When you get to this form, you want to verify that the name of the pharmacy written here is your current pharmacy so that you do not enter stock for a wrong pharmacy. So the record date is today. So the name of the pharmacy is already here and it's going to be populated based on my current assigned pharmacy. The name of the drug I received. So I want to start with this and I received 50 milligram. So you see there's a drop-down menu of drugs. This drop-down menu is only populated because the central medical store entered this medication. Any medication central medical store does not enter as a stock that they are distributing will not show up on this drop-down menu. So you have to tell me in the countries if you get medications outside of the central medical store. Then in that event, I will have to let this be something you can create a stock outside of central medical. But the patterns currently on the system is central medical store creates the medication list based on the stock they have. And then you only see this drop-down menu populated based on what central medical stores have. So if you have another request based on this, you can send me an email and I will update the system. So the form now is tablet. The manufacturer, you have the list of manufacturers that the central medical store ordered from. And I will choose any one. It might not be consistent with the scenario. And the scenario doesn't actually hold the manufacturers. And the expiry date, we'll just put in any date and assume that it is the correct date we have that the central medical entered. The batch number, you will have the list of batch number of all the drugs and then the quantity received. So let's assume that we are receiving 50 of each drug. This is in HDPE bottle and the amount in each of the bottle is 30. Then we have other medications. I am going to enter as much as we will need to fill in prescription. So let me put this. The medication name is, let's do AZT 3TC. So I'll do FTC. And the FTC is 10 milligram per ml oral solution. Form, manufacturer, expiry date. Batch number, quantity. So let's say we receive 30. The packaging and the amount per pack, we have 240 mils in the bottle. So now you get the idea of entering stock in your pharmacy. And what we are using is this scenario that says that your pharmacy received the following supplies. So you have the drug name, the strength, and the form of the drug. You make up the expiry dates, the manufacturer, the batch number. You can select from the populated list on the system for the purpose of trial, but in real life, you will have those information. Once you are done entering your stock, you come back to pharmacy, and then you come down to view stock. Now, you will see that any of the medication you entered that has quantity less than 50 will give you an alert of you have this medication and the quantity you have left in it is 30. So you want to make a decision if you want to place an order early or 30 is just enough for the amount of clients you have. Then you have this expiring soon in your pharmacy. So you want to see if Central Medical has this same medication that is not expiring in August of 2022, but they have the same medication expiring at the same time. So you cannot order from Central Medical because you have excess, or you want to decide to return whatever the regulation or the rule is. Then below, you have all of the medication here, and that's the ones we just entered, and you can edit if they're not correctly entered, or you can recall if you need to delete, or if the medication is expired and you want to send it back, or manufacturer has recalled, or there was adverse drug reaction and the doctors have stopped prescribing it. So you can recall that out of your pharmacy to return. The next thing you want to do after that is to come to Dispense Arvs. You use Dispense Erv form for clients in care. The name of the pharmacy again is here. So to remind you that if this is not your pharmacy, you have to go back to your welcome page and switch your pharmacy. So you fill in the telephone number of the pharmacy. The prescription number is auto-generated, just in case you miss it, but you mustn't use that prescription number. So you can decide to, if you have a sequence of numbers you want to use, let's say RX1111. The prescriber's name, let's say we have a Dr. B. The date on the prescription form, let's say the prescription was sent on the 3rd of February, 2022. Then we have a client whose unique ID is, I'm going to use any client's unique ID so that we can demonstrate better. So I will say the unique ID of this client is this, the date of birth of the client. So let's assume this client was born on the day is on the 2nd of January, and the client is born in 1980. The sex of the client is male. Allergies, there's no known allergies. The name of the drug now. So if the client was prescribed this, and this is what you are dispensing, and you are dispensing that medication, you're dispensing the 200 milligram capsule, but the client was asked to take 600 milligram, let's assume. So the strength is 200 milligram, the form is tablet. The frequency now is, so you are putting 3 tablets, take 3 tablets. So let's say take 3 tablets at once in the morning, or we'll say at night before bedtime. The quantity now you are giving out. So they're asking him to take this medication for 30 days. And the dose is 600 milligram. But what you have is a 200 milligram tablet. So he's going to take 3 of that, right, for 30 days. So you're going to have 90 tablets, right? Am I right? So quantity now is 90. So you can put the direction for use. Sorry, this frequency now is direction for use. And then we put the frequency now is once daily, right? And the date of dispense now is today. So we want something that shows us the difference between prescription date and dispense date for the clinical management team to be able to see the drug pickup difference, and then the adherence counselors can see what now happens between the 3 weeks or the 2 weeks without medication of the client. So the client is not adherent because they have missed for 2 weeks. You want to find out if it's a stock out reason or is a client-related problem. You want to find out from the clients why they did not pick up the medication on time and they stayed 2 weeks without drugs. And so that is the importance of the date of prescription and the date of dispense. And so the pharmacy will have to discuss with the clinical management team on how the prescription forms are filled so that no field is missing for the pharmacy. So the drug expiration date. So if you are dispensing like a loose tablet from a container, you want to put in the expiration on the pack for the clients. So let's assume this is expiring in 2024 and the drug was picked up by, let's say it was picked up by me, and remarks, let's say 2 refills left. So you get the idea on how to fill in the dispense. So you save this so that you can print out the label. Once you have filled in, so on a prescription, you will have multiple drugs. You have to fill in each medication. If they're not a combination tablets, you have to fill it in one at a time and put in the prescription numbers. Prescription numbers have to be unique, but the client's unique ID remains the same.
Question, Mildred.
Yeah.
You keep talking about the prescription number.
Mm-hmm.
For example, I don't think, do we have the prescription number? No. And then a prescription that is written sometimes for 3 months. If you come back into the system and put the same prescription number, will it record it?
Yes, you grab so now we put 2 refills left, right? So if the person comes back the next time and the person comes with a unique ID, you just pull out how many refills are left and what was dispensed the last time. So the person doesn't necessarily need to have the prescription for other refills once you've entered it once.
Okay.
So once you are done filling in all of the medications on the prescription, you come back to pharmacy now. You want to print out the sticker that you use on the drug. Now, before we get to that, there is a second dispense prep or PEP. So if the client is not an HIV positive client in care and is somebody who is using the medication for other purpose, then you are not dispensing, you are not going to use dispense. So the one with the form we just use is to dispense ARVs. So you won't use the dispense ARV, but you use dispense prep or PEP. The reason is the system stores this differently for reporting purpose. And not all of these clients will have a unique ID because they might not be registered in care, HIV care. They might be having post-exposure or pre-exposure from the emergency room or from a private doctor that monitors them, and they don't go through the normal procedure. So they might not have an account on the system. In this case now, you will enter the name on the prescription, or it is even not for any HIV related and it's for treatment of other conditions. You want to enter the names now. You give the unique ID now, or the code will be like the hospital registration number on the prescription form you find. And your prescription number here will be changed to whatever you use at the pharmacy for a prescription number. And the rest of the form remains exactly the same. So now it's time to print label. When it's time for you, yes, Lester?
Yeah, so for example, I'm looking at the prescription from the Princess Margaret Hospital, and they don't have prescription number. So is that a compulsory field?
Yes, but the pharmacy always have prescription numbers. It's the way they index the prescription. So it's not, prescription numbers are not filled in by the doctor. They're filled in by the pharmacy, by the pharmacist in the pharmacy. So they have their own sequence of number. I think every pharmacy has one. And so they're the ones to give a prescription a number at the pharmacy.
Okay, thanks.
Okay. So once you are done, and it's time for you to print out the label. So let's assume that the person who is entering this is different from the person who is going to count the medications and put a sticker on it, and you pass it over. The person will have to enter the unique ID and that prescription number that we used just now. And it was RX, was it RX 1111? So let me try this. I hope this is what we did. And then the care point is client in care. So we have 4 care points. Is it pre-exposure, post-exposure, or other? So it knows which database to select from. And you print, collect, get label. So this does not have it. So we enter the wrong prescription number. So I want to look at the prescription number because now I've lost the prescription number. I'll come back to pharmacy and I'll come back to view all transaction history. And this will now give me the prescription number and the unique ID for the clients that I just filled in the prescription. So this is where you retrieve whatever you have lost because this gives you all of the entries you have made for the day. So now I have the prescription number. I can come back here to the label to print the label. So I have my unique ID, I have my prescription number, and I have client in care, get label. So now I have that label that has the name of the pharmacy, the phone number, the prescription number, the prescribing physician, the date of the prescription, the expiration date. We have the name and strength of medication, the identification of clients, and the dose or direction for use. So you can now print this out, click on print, and print it out on the, and you now print it out on the sticker or the label and attach to the drug. Once you are done with this, and it's exactly the same procedure if you are printing this out for other purposes. So you put pre, post, or other. So the doctor will have to, once you have a prescription that doesn't have client in care, you can use any of these. Most of the time you want to use other if you don't know why it is prescribed. But if you need to know why, and you can't reach the doctor, and the client is not telling you, then you come to pharmacy here, you get the unique ID of the client, and then you come view client's treatment plan. And then when you put in that unique ID here, if the client has a record on the system, it gives you the plan of the doctor that is in the client's care card. So you have access to the treatment plan of the client based on the symptoms, and you have all the history of treatment plans that the doctor, so you know why the doctor prescribed this. So here you will know that this client is symptomatic and you are doing like an OI prophylaxis or something. And then you want to look at the treatments, and we can see that, okay, the client is going to take isoniazid for 8 weeks and will take this medication for 1 month. This is the treatment the doctor wrote in the care card that the client takes. And this is not the prescription you are dispensing, but what you are dispensing is not on the care card. You might want to ask questions on, maybe it's not the same doctor, maybe it's not from the HIV clinic, or you want to find out if the client is currently taking this, and if there's a drug-drug interaction, you know how to counsel the client on the timing of taking the medications. So all of the treatment plan, the symptom review, and the plan of the doctor for each client, the pharmacy will have access to in case you need to verify anything and you cannot reach the doctor when you dispense and when you want to counsel the client on how to take the medications. Now, once you have done all of this, in the events where you need to see the treatment history of a client, maybe the client has said that they always come to the pharmacy for a particular drug, and you want to verify. Now you enter the unique ID, and you get prescription history. So we do not have this unique ID on the system, and this is the error you see. It will refresh, and I'll get the unique ID now. And once you enter the correct unique ID, you will see all the drugs that have been dispensed, not just from your pharmacy, but from all of the pharmacies in the country. So if this client has had a medication dispensed from another pharmacy, you will see that this particular person with this unique ID already is on this medication from a different place, from a different doctor. And you can see all of the drug history of the clients on the system. And this concludes all of the functionality for central medical store and pharmacy. So we'll take questions before we use the scenario to record prescription and dispense. We have the scenario on page 2 that gives us client's unique ID, the prescription numbers to use, the name of the drug, the dose, the frequency, the duration, the date of birth of the client for you to try out how to record the dispense. Questions? Clarifications?
Mildred?
Yep.
For us here in Antigua and Barbuda, we use the same code that the patients use for PrEP and PEP. So I guess with the name and first name, last name that is now introduced, we will have to have some form of discussion regarding that, because we do not use any names here when it comes to dispensing of ARVs.
Okay, so on the PrEP and PEP, in this situation now, where you need to enter names, you either put the initials of the first and last name without having to fill in name. So once you don't enter name, you can fill in unknown and just focus on the unique ID here or the client's code. But the reason this is here is in the event you are dispensing this medication for clients whose purpose you do not know, and maybe they're using it for other treatments that is not related to prevention and is not also related to prevention or HIV care.
Well, if that is the case, at least for Antigua and Barbuda, the doctors usually put a note to the pharmacist regarding the purpose of the medication. If the medication is for PEP, then PEP is written. If it is for PrEP, PrEP is written. And then we know that for PrEP, it's Truvada. And if they're going to take PEP, then they definitely will take either the triple or the combination with Calitra.
Okay.
So the medication is not the same, except it is for somebody who is HIV positive, but it is written PEP or PrEP in our case here.
Okay. So anyhow you decide and anyhow you guys do it, right, in the countries, the form is flexible to allow you enter it based on how you enter. In the events where any of the field becomes compulsory, just fill in unknown so that it can let you pass. But the reason for this separation is, one of the reporting indicators, you want to know the number of clients on PrEP, right? And then when it comes to side effects monitoring also, you also want to know the clients in care who maybe dropped out of treatment failure or they changed medication based on side effects or something. And we want to be able to effectively calculate that for the HIV positive clients. So that is why there's a separation between how you dispense the ones in care separately from the ones in PEP. Another thing I can do is to combine the form and just put one line on this form of dispense ARV of reason for dispense, just put clients in care, drop down. So there'll be no need for this PrEP and PEP form because the system will automatically know where to send the data when you save. So what I'm saying now is I can make it easier. Instead of having 2 dispense, I will just put only 1 dispense ARV and put a field here that says reason for dispense and a drop down menu to say client in care, PrEP, PEP, other reasons.
Yes.
Okay. So let me.
That makes sense. That will make it easier too. And with regards to monitoring of the side effects, most of the persons on PEP, they go through the clinical care coordinator. And then they're monitored by the clinical care team with regards to the side effects. And they are also counseled by the pharmacist before issue. So I think we have a little more hang here. I don't know about the others when it comes to persons on PEP. The monitoring is done by the clinical care team. In fact, if I interview someone who have to go on PEP, then I have to follow up with that person until they finish their medication and have them retested. So that's the protocol here. And then when you would have seen the pharmacy record, all persons who are on PEP or on PrEP, that will be a part of the pharmacy report.
Okay.
Benefited.
So, I mean, can anybody who is in the pharmacy, if you have in reporting indicators for pharmacy, right now I'm just working blindly when it comes to pharmacy reporting. If you can email me after this session, all of the reporting indicators for pharmacy or the type of report you want to see for pharmacy. What I'm working with now is stockouts, dates, stockouts, the duration of time between stockout and replacement, when they cannot dispense a medication because they're out of stock, the distance in time between prescription dates and date of dispense, and we'll see if that's the day definitely they dispense on the day that the client comes in. And then I also have to see the different kind of drug dispense by age group of the clients. And so this age group of the clients will now depend on the date of birth entered on the system. So if there are other reporting indicators that I have not captured, so it will give you, okay, list of clients in care on arts, list number of people on PrEP, on PEP, all of that will come out from pharmacy reports.
So sorry.
Yeah, no, go on.
Yes, I'm thinking because I review the pharmacy record just because I'm the HIV case manager. And sometimes I want to get all the persons who have renal failure, but I have to go through each month to look for that. Is there any way that at least, rather than to take a little stress, at least from me who want this information, that will be easy accessible?
Yes, so that will be from the client care card. So what I can do, I'll put that reporting on the national reporting dashboard, where you will see based on the screenings and the treatment monitoring. So recall that during the clinical management session, we looked at the treatment monitoring form where you can select the different types of liver failure, renal failure, all those stuff. So you can now calculate the number of people who are on ART, who stopped because of side effects, and this kind of side effects. You can now cluster or aggregate data by clients and on arts and the side effects. So you can see the most common side effects that people complain about and the most common, very serious side effects.
Yes, thank you very much. But would I be able to see, because sometimes there can be a mistake with regards to dispense, like if a patient is hospitalized, the new doctor may not be clear and they may give the person daily medication, which is like for renal failure. So is there a way that can, if that happens?
So that's why the pharmacy will have to see the treatment plan. What I can add on that treatment plan page is to add, so if the client already has renal disease, there's some medication that will be substituted, right? So that the client doesn't go into renal failure. So in that case, if the doctor makes a mistake, I'll put it on the pharmacy care card for the comorbidities. If the client already has renal disease, then the pharmacy can call the doctor to say, this medication will make this worse, or the client is already having renal failure and we can't put this. So I'll leave it on. What I will do for the pharmacy is I'm going to leave this on the client's treatment plan. I'm going to put that flag on the page of allergies and the flag of comorbidities that the client has, so the pharmacy can be informed when dispensing. Then on the client's treatment form in the doctor's office now, when they're filling in that prescription or those medication or the treatment plan, the comorbid information is already flagged on that page. So when the doctor is prescribing, they know exactly what to substitute with or what to monitor for when the client returns.
Thank you very much.
Okay. Any more suggestions? So what I like us to do is, if we are from different countries here, I want us to come back to the home page here. You switch your pharmacy to, if you are from Antigua and Barbuda, put Pharmacy Antigua, Pharmacy Grenada, Pharmacy Dominica, Pharmacy St. Kitts and Nevis, Pharmacy St. Lucia, and St. Vincent. So switch your pharmacy to the pharmacy of your country. And then once you switch your pharmacy, I want you to come to the case scenario and enter all of these drugs as the stock that you have received at the pharmacy. Once you enter these drugs at the stock you've received, then go ahead. So apart from this drug, strength and form, you make up expiry dates, manufacturers, batch number, you will see a drop-down list. If you don't have any of this medication on the drop-down and you need to fill it in, go to Central Medical Store, create that stock, and fill it into yours. And then you want to try out the dispense. And so just use dispense for clients in care and use all of these medications. Now, there are some medications that you might not find on the list that is on this prescription. Just ignore them or do a substitute. The whole idea now is to do a trial. And after this session, I'm going to go back to the system configuration to make sure everything that we need to dispense is available in the drop-down menu. So should we demonstrate here? Does somebody want to share screen or you want to do it privately? So you decide.
Is it okay that we demonstrate here?
Okay.
Thank you.
Okay, so I will stop share and whoever wants to take the lead, you can start. If you're not comfortable with it being recorded, I can stop recording also.
No, leave the recording.
Okay.
Thank you.
All
right. In a way, I am comfortable, but I would prefer if someone would share and give it a try.
Okay.
If anyone is up to it.
So anyone, you will try under guidance, but it's going to be more you understand what's you. Okay, let's start sharing. That's good.
Oh, okay, you can hear me? Hello?
Yes, Mr. Guy, I can hear you.
So
Loud and clear.
I don't think I'm on the system. That's the problem.
Can you hear me? I can hear you clearly.
Kevin, I can hear you.
Okay.
Mildred is there?
Yes, I'm here.
Okay, but I need to open the system. I need to open a system on my end, no?
Yes.
So can you place something in the chat for me?
CBS4, just go on your browser window. CBS4.
CBS4?
Yes, that's. And then you are on the wrong login. Go back to up. No. Go to the profile icon on the right side of the page. Yeah, go to home. Then go back to the profile icon. Profile icon. And then click on login to patient management and reporting system. Now login.
Cups. Okay. Okay, I don't know what's going on there.
But you've logged in successfully before?
Yeah. That's not, I'm not looking now.
So go to click here to reset your password under the login button. Yeah. So enter your email address. Okay.
Lester, you were putting up the M in uppercase.
Doesn't matter. If you're watching an email, even though it's in uppercase, it doesn't change anything.
Oh, okay. All right. Yeah.
Yep. So you put in a new password.
All right, so I can go here now, yeah?
Yep. Login. Yep. So choose pharmacy Dominica. Change.
Yeah?
And then, yes, perfect. So go to pages. Scroll down to pharmacy.
Wait, stock?
Yeah, view stock. No, view stock first to see what you have. So when you scroll down, you see, scroll down to the end. You have just one stock that was entered during the last practice. So,
Okay.
so you can now start creating stock based on the scenario.
This is what I'm going to enter in, yeah?
Yes, so these are the stocks you received. So just try entering a few to get used to it.
Abacavir, 200 milligrams tablets.
So go to pages on the right, on the left, sorry.
This one?
Pages on the left, yeah. So scroll down. Pharmacy. And then create stock.
Create stock. Okay. Now let us give me a second. Let me just take a call from our IDC clinic, yeah?
All right.
Okay, I'm back.
All right, so enter the stock that you received.
Today is the 21st February 2022. Cms Pharmacy. ABC, I think, yeah.
Yeah, ABC.
300 milligrams.
300, yeah. And the form is tablets. The manufacturer, just select anything there.
And
Select any expiry day, month, yeah.
Which number? 5. How many we see? 300?
Okay, so let's assume you receive 300, yeah. So packaging. No, okay, container.
Container, yeah?
No, put it in bottles. Just put the bottle so it will be easier for, yeah. And amounts in a pack, let's say 30 or 60. And then add. Put in the next stock. No, you're still on the page, so it's clear for you to put in the next.
All right, so give me the next stock. I can see them. I'd have to share screen still 21 February 2022. Hey, Nadine, I'm doing a little practice session with Mildred. Can I call you back? Okay, no problem.
So
What's the other one we have?
So let's FTC.
FTC.
It's a bin, scroll down. Yep. And we have it in 200 milligram capsule. The form is, no, select form now. Capsule.
Capsule. And capsule.
Yep. And the manufacturer, select anything there.
Laboratories. 7, batch number 998, quantity. How much?
So
500?
Okay, just say you received 30 of them.
30?
Yeah, 30. And the packaging is in the bottle.
Oh.
And 60 per pack. Then you still have more. So let's say you receive AZT also now. So we'll just keep and enter a few.
Also, I have to, but I must put it, okay, well, no problem.
Yeah.
So, will you see AZT?
Yeah, AZT. And you receive 100, let's say the 10 milligram per ml oral solution. So liquid. Manufacturer, anybody? Expiry date. Quantity received.
50?
Yep. The packaging.
Oh no, it would be that bottle, not
bottle. Yeah.
This bottle, yeah.
Yes, and it's 240 mils in a bottle.
Ah.
Yeah.
So that 240 will represent mils, not tablets.
Not tablets. Yeah. So the system knows once you see that you didn't select see that it is an oral or liquid form of drug. So we know that everything there is in mils. So we can put EFV also now. So now you get the idea of creating a stock, right?
Yeah.
Just enter one more and then we'll try dispensing.
How much is it? What is that?
Yeah, that's 200 milligram tablets. So make sure it's expiring. Try this one to expire, yeah, in September this year, 2022. Bat number. Quantity received. Packaging.
Bottle?
Yep.
How much per pack?
30.
All right, great.
So now you get the idea. Go to view stock, pharmacy, and then scroll down and view stock. Now you can see your flags. Scroll up. So you can see that you have FTC 30 quantity left. And then you'll know that at the Central Medical Store, scroll down, no? At the Central Medical Store, you have the same FTC available, but it expires in August. So you want to decide if you want to still order that. Now, when you scroll down, you look at your stock, everything you entered is here. You can go to Dispense Erv now. If you have a mistake here, you can decide to edit and save or recall. So go to pharmacy. So just fill in any number there. You can change the prescription number to something you can remember.
Prescription number? Okay.
Yeah.
So something I can remember?
Yep. So prescriber's name. So no, let's put the date of prescription. Okay, just leave it there. It's okay. February. So the person came on the same day that the medication was prescribed. The unique ID. So use SVG.
SVG
02
02
02
02
02.
02.
So the date of birth for that client is on the 1st of January.
Okay, 1st of January.
Yeah.
Yes, January.
1982. So on this drug, there is an EFV, the male.
Male?
Yes, I think so. Yep, male. Then, no, just EFV and 600 milligram for 1 month. Tablets.
So this is 600 milligram is
Once
frequent.
daily. Once daily.
Daily.
Yeah. So the quantity now will be 30.
No, it will be 30 because it's 600 milligrams and it's 30 milligrams, so it's 60.
So it's 60 now, yeah. So it's 300 milligrams, so it's 60. Yep. And then direction for use now, you now type, take 2 tablets at once.
That much.
Mhm. So I think this EFV, it's more preferable to take at bedtime and on an empty stomach, right?
Yes, that's the nightly medicine.
Yeah. So you want to take, I think EFV is a night drug.
Yeah.
Okay, then date of dispense is today's date. Then picked up by, just put the name of the patient. Okay, mother. The name of the mother.
Also, I put the name.
Yeah. And then the remarks, dispense in full, no refill left or something, anything. And then save. Save now.
Oh, save and print. Okay, save.
Now, once you are done, it clears out for the next drug. But since you get the idea, we'll just move to print label.
What?
To print the label, go to pages. No. Go to pages now. And then pharmacy. And scroll down. Then print label. Then the unique ID of the client is SVG 020202. The prescription number. You use RHC 001. The care point is client in care.
Client in care, yeah?
Yes. And get label. So you can now click on the print button to print the sticker you put on the medication. If you want to redirect it to print, so you can cancel.
Okay.
Wonderful. So you can go back now.
Click on the back.
Click on the back button. Up at the.
This?
Yeah, the back button up at the browser. Yep. So go to pages. Scroll down. Pharmacy. Scroll down. Then you can view all transaction history to see all of the dispense that has happened at your pharmacy. That has happened for I don't think, no, this does not depend on the pharmacy. It's general, but I'm going to change this now to make sure you only see the dispense from your pharmacy.
All right.
So I'll change that. Then you can go back to pages.
Pages. This one?
Yes.
Yes, view client's treatment plan, yeah?
Yep. Yes. Then enter the unique ID SVG. 020202 and treatment plan. Then now you can see, so in the event there was a confusion or something, you can see what the client has, why they prescribe the medication and other medications. So you can go to, that's for the symptom review and plan, go to treatment tab, the second tab.
This one?
No, the second one now, treatment. And then you can view all the medications that the client is on from all the different doctors that are on the system.
Okay.
So you want to see if the client is on this and the other one is already, so you see the client is on this. If this has been dispensed and the client is coming for EFV alone and that same job, so you know that the client is already taking this. You want to see if this was ever dispensed to the client in combination. So you don't need that single dispense. So this is how you view, if you want to resolve a conflict, view the treatment and the symptom review plan without having to call the doctor. If in the event you can't reach the doctor.
So the pharmacist can do that on their own.
Because yeah.
Whatever the doctor would have entered, the pharmacist have access to it when she's on her platform, yeah?
Yes, the pharmacists have access to the treatment plans of every client. So once there's a conflict and the doctor cannot be reached or the pharmacy wants to make a decision, they can view all the other treatments. So this treatment is not just from the HIV clinic, it's all the treatments that was filled into the system for the clients, whether for other conditions or for TB. The pharmacy will see all the drugs the client is currently taking or that was prescribed. So in the event that that medication was not dispensed at their pharmacy and they have no knowledge of it, they will see that this client is already on this medication from somewhere else.
Okay, wonderful.
Yep. So you are now a pharmacy expert?
Yes, ma'am.
That's good. So anybody else want to try? If not, this is where the session ends. If you have questions or recommendations, you don't want to mention it here, you can still send an email. preferably all the emails for recommendation should come in before the end of this week, because starting next week, it will be very difficult to continue to change and update the system when we are rounding up. But you can still send the recommendations, but just that I will not be able to include recommendations after Friday until the workshop is over, and I'll include them in March. So if you have them early, send them before Friday. If not, still send them, but I cannot guarantee you that you will find your updates before March if it's not sent by Friday. So thank you very much. We can do an introduction for the sake of attendance and the new people here. My name is Mildred Fakoya. I am the developer of this system. I am a software engineer and a data scientist for Health Information System, for Education Management Information System. And I am also the consultant for case-based surveillance in the region.
All right, I am Lester Guy. I'm the NAP coordinator, Dominica.
Karen Robertson, HIV case manager, Antigua and Barbuda.
Judy Nisbet, CCC Neves. I joined late, but I'll look at the recording.
Odinga Warner St. Vincent, SVPPA Director, VCT Tester.
Gracious James, Nevis Pharmacist.
And Roy Edmond, Acting Chief Pharmacist, Dominica.
So we have Jonelle Benjamin, Program Coordinator, Grenada, in the chat. Next, we have 15 people on this call. So other people, introduce yourself, please.
Dr. Stephen Ajamile, guest on the training.
All right, since we are done with the introductions for those that want to introduce, this is where today's session ends. I will upload the, I'm going to upload the recordings before the end of the day. And we have Lyntia Bockmeyer, clinical nurse, GPPA, and we have Kevin Gregoire, Dominica. They all sent their introduction in the chats based on, because they have internet issues. So thank you very much for joining and enjoy the rest of your day.
Thank you.
Okay, bye-bye.
Bye-bye.